Hello everyone and welcome back for the last session of Biology Chapter 10, Human Health and Diseases. Last time we studied about cancer and AIDS. Today we will study about adolescence. What is adolescence? Adolescence is a transitional state of physical and mental development of child. It occurs between puberty and legal adulthood. 10 to 19 years of age where individual is no longer a child but not yet an adult is considered as adolescent. It is a phase of life and not the fixed time period in the life. It is a phase of development like sexual maturity, mental development, adult identity, etc. Now, stages of adolescence. The Government of India, in its National Youth Policy, defines adolescence as 13 to 19 years, and it has been divided into 3 stages. First stage is early stage, that is the age between 10 to 14 years. Second stage, which is called as middle stage, that is between 15 to 17 years. And the last stage is late stage, and the age is between 18 to 19 years. Let us see the details of first stage, that is early stage. Early stage includes changes like appearance of secondary sexual characters. Now, what is secondary sexual characters? The part in your body which makes you feel what you are. That means a male looking like a male or a female looks like a female. That appearance is your secondary sexual character. For example, in males we have development of mustaches, beard, deepening of voice, etc. These are the external appearance which gives male a male-like appearance. Same way in female, the appearance will be considered as secondary sexual characters. Then it includes growth, which reaches to its peak. There will be a rapid physical growth. There will be concrete thinking. Concrete means the things which you see in your surrounding. And you think on those bases. That is concrete thinking. Defining boundaries of dependence or independence. All these stages are self-exploring type of stage where you want to explore things by your own self. There will be development of body image. A person looks at his whatever physique, whatever appearance the person has and tries to make a particular type of image. That is development of body image. There will be development of intense friendship in this age. Seeking to encounter instability, and the main thing is evaluation. They always evaluate the thing. This all you can see in the first stage, that is the early stage of adolescence. Then coming towards the next stage, that is middle stage. In this, there will be full development of sexual, that is secondary sexual characteristics. Growth will slow down. 95% of adult stature will be attained. Thinking will become abstract now. In initial stage, there was concrete thinking. That means whatever you see, you think according to that, on the facts, on the realistic things. And now your thinking will become abstract. That means you will start imagining. Imagination power will increase. Concrete thinking will be there, but it will be only under stressful conditions. Re-establishing of body image takes place. They are capable of long-range thinking. Sense of leadership and all-powerfulness develops. They will be preoccupied. They always will be preoccupied with romantic fantasy. Ability testing to attract opposite sex. Peer group help defining behavioral code, etc. All these things will be there in the middle stage of adolescence. Then coming towards the third stage, that is the late stage. In this, there will be total physical maturity, abstract thinking, intellectual and functional identity develops. Peer group resides in favor of individual relationship. Stable relationship occurs. Change from childhood to adulthood relationships takes place. Now, next is the physical changes of adolescence. The first change will be growth spurt. You can see these physical changes occurs in both boys as well as in girls. Now, growth spurt in boys will be like, it will show muscles development, skin becomes oily, broadening of shoulders takes place, cracking of voice, development of underarm, chest hair, pubic hair, facial hair, etc. takes place. Enlargement of penis and testis takes place. Whereas in girls, there will be development of breast, widening of hip, development of underarm and pubic hair, and enlargement of uterus and ovaries takes place. Second physical change is sexual development. In both male as well as in female, that is in boys as well as in girls, you will find this sexual development takes place. Here you will find sex organs mature and enlarge. There will be sexual desire, erection of penis, sperm production, ejaculation, ovulation, menstruation, and initiation of sexual behavior takes place. Now, third change or next change is emotional and social change. In this, you will find there will be establishment of own identity, fantasy, daydreaming, attention-seeking behavior, emotional instability. They will be full of energy. There will be sexual attraction. There will be rapid mood changes. And these changes will be due to because of conflicts with family. There will be behavioral code, and this code is actually influenced by peer group, that is the friend circle which a person has. There will be self-exploration and evaluation, formation of new relationship and peer pressure. These are certain physical changes. One was in growth, second was in sexual development, and third is in emotional as well as social change. Now, next part is mental health and adolescence. The mental health implication includes confusion. They will be more confused because sometimes what happens, your parents may say that you are too small to do certain kind of thing, and sometimes they will say that you are big enough to understand the thing. It makes or creates confusion in the mind of adolescents whether they are child or they are adult. So there will be lots of confusion in their mind. Then irritation, frustration, moodiness. Sometimes you'll be like, you will feel very happy, sometimes you will feel so sad, sometimes you want everybody around you, sometimes you don't want anybody along with you. These all mood changes takes place in adolescent stage. There will be irritation. Most of the times they will be irritated with little bit of things. Then nausea, less concentration, hyperactivities, and anger. Then there will be certain effects on lifestyle. That means some of the adolescents will have certain different kind of things like obesity. Some of them may get involved in addiction, accidents, or ill health. Mental illness is in different forms of depressions like insomnia. Insomnia, there will be lack of sleep and loss of energy. It is associated with psychological or behavioral manifestation. They are classified into two different types, that is either psychosis or neurosis. If we talk about the mental illness, that is psychosis, then it includes delusions, hallucinations, disturbance in thinking process. Here, whatever you think, you imagine, you feel like the things are happening in front of you. That is psychosis. And it may lead to certain kinds of diseases like Alzheimer's disease, schizophrenia, depressive psychosis, amnesia, that is loss of memory, bulimia, that is extreme overindulgence in food, anxiety, anorexia, or depression. Now, second condition of mental illness is neurosis. Neurosis includes schizophrenia, illusions, hallucinations. Adolescence, you can say, is characterized by number of cognitive, emotional, behavioral, physical, and attitudinal changes. It may lead to positive personality development depending upon the relation with parents or to conflicts to other side. They view their friends or their peer group more important and influential than their parents. This may lead to various kinds of addictions like smoking, taking drugs, etc. Now, treatment. How can you treat adolescence? Because it is not a disease. So, treatment should be done with non-pharmacological approach with due respect to rights of children. WHO has recommended evidence-based guidelines under Mental Health Gap Action Program. So, you can treat adolescent by love, care, and affection. Now next we'll study about addiction. It is a complex condition characterized by compulsive use of substance despite of its harmful consequences. Addiction may involve the use of substances like alcohol, opioids, cocaine, nicotine, and others, or behaviors such as gambling. It overall results in the impairment of physical, physiological, and psychological functions of the body. Now, causes. What are the causes of addiction? Insufficient parental supervision and monitoring. Lack of communication between child and parents. Poorly defined rules. Family conflicts. Favorable parental attitudes towards alcohol and drug uses. Expectations from drugs use and risk-taking behavior. So mainly the cause of addiction is family background. Family plays a vital role. Now next part, measures to control addiction. We know a proverb, that is, prevention is better than cure. Avoid undue pressure. A child should not be forced to perform beyond his or her capacities in studies, sports, or in any other kind of activities. Education and counseling of child to face problems and stress is necessary. Child should be asked to accept disappointments and failures as a part of life. We should channelize the energy of a child in sports, studies, and other constructive activities. Now next, drug abuse. Survey and statistics show that use of drugs and alcohol has been on the rise, especially among the youth. It could result in many harmful effects. So proper education and guidance would enable a youth to safeguard themselves. The drugs which are commonly abused are opioids, cannabinoids, and alkaloids of coca. Now we'll study in details. The first is about opioids. These drugs binds to opioid receptors present in the central nervous system and gastrointestinal tract. It includes heroin, which is also called smack. It is chemically diacetyl morphine. It is extracted from latex of poppy plant, that is Papaver somniferum. It is depressant and slows down the activity of body. Next is cannabinoids. It interacts with receptors present in brain. Inhalation and ingestion of these substances affects the cardiovascular system. These are obtained from inflorescence and parts of cannabis sativa. It includes marijuana, hashish, charas, and ganja. Alkaloids of coca. Alkaloids of coca includes first cocaine. Cocaine is an alkaloid obtained from coca plant, that is Erythroxylum coca. It increases the level of neurotransmitter, that is dopamine. Its excessive dose causes extreme happiness, irritability, or paranoia. And second one is hallucinogens, that is mind expanding drug. These alkaloids causes daydreaming. It includes lysergic acid and cannabis, Atropa belladonna, and Datura species. Datura species also have hallucinogenic properties. Hallucinations are unreal perceptions of unreal object due to the disorder of nervous system. Now, addiction and dependence. Because of the perceived benefits, drugs are used repeatedly. Addiction is a psychological attachment to certain effects like euphoria and temporary feeling of well-being. With repeated use of drugs, the tolerance level of the receptors present in our body increases. Due to this, they respond only to higher doses of drugs or alcohol, leading to greater intake and addiction. The person shows a withdrawal symptoms if a regular dose of drugs or alcohol is abruptly discontinued. These symptoms are anxiety, trembling, nausea, and sweating. It may be retrieved when use is resumed. Now, effects of drug or alcohol abuse. The immediate adverse effect of drugs and alcohol abuse shows reckless behavior, vandalism, and violence. Excessive doses may lead to coma and death due to respiratory failure, heart failure, or cerebral hemorrhage. The most common warning signs of drugs and alcohol abuse among youth includes drop in academic performance, unexplained absence from school or college, lack of interest in personal hygiene, withdrawal symptoms, isolation, depression, fatigue, aggressive and rebellious behavior, deteriorating relationships with family and friends, loss of interest in hobbies, etc. If abuser is unable to get money to buy drugs or alcohol, he or she may turn to crime. It becomes cause of mental and financial distress to entire family and friends. Those who take drugs intravenously are likely to acquire infections like HIV and hepatitis B. Use of alcohol during adolescence causes long-term effects like lost balance, liver cirrhosis, pancreatitis. Chronic use of drugs and alcohol damages nervous system and liver. During pregnancy, it adversely affects the fetus. Certain sportspersons misuse drugs to enhance their performance. They start using narcotics, analgesics, anabolic steroids, diuretics, and certain hormone to increase muscles. Now, the side effects of the use of anabolic steroids. It shows effects in both male as well as in female. In females, it shows masculization, that is, features like male, increased aggressiveness, mood swings, depression, abnormal menstrual cycles, excessive hair growth on face and body, enlargement of clitoris, and deepening of voice. In male, it shows acne, increased aggressiveness, mood swings, depression, reduction in size of testicles, decreased sperm production, kidney and liver dysfunction, breast enlargement, premature baldness, enlargement of prostate gland, etc. These effects may be permanent with prolonged use. Now, prevention and control. Again, we know the proverb, prevention is better than cure. This proverb holds true for all addictions. Addiction is more likely to occur during adolescence. It is better to identify the situations and take remedial measures in time. In this regard, the parents and the teachers have a special responsibility. We all know that taking up addiction is very easy, but to leave addiction is difficult. That means de-addiction may be difficult, but not impossible. Remember, de-addiction may be difficult, but not impossible. That's all for the day. We have completed the entire chapter. Thank you so much. Take care of yourselves.